Yes, that is very important. We have a special consultation every week on Mondays for patients that they want to become pregnant, patients that they are pregnant, or patients in the postpartum time, so that more or less 1 year after the delivery. And our objective is to follow all these patients in a prospective way from the beginning until 1 year after the delivery. The problem in the MS is that many women, they are young and they want to become pregnant, but 1998 was a study that was a very big study published in the New England Journal that this study was reported that after the delivery, the patients, the probability to have a relapse is 30%. So for this reason, many patients and many physicians, they were afraid that the patients can become pregnant because otherwise later in the delivery, they can have a relapse. So there are some studies from the MS base that they say the probability of the relapses are 40%, so 14, so that's really is lower than the 30%, but it's still a lot. So that we were studying the subject how to reduce the relapse rate after the delivery. So for this reason, we have done a strategy. So that the strategy is to have the patients very stable before the pregnancy. Patients should have no clinical and no radiological activity, no relapses, no new lesions in the MRI. Later they can become pregnant, and after the delivery, we do an MRI 2 months later. When in the MRI there is some lesions, we stop the breastfeeding and they can start the new treatment. And in patients that they are highly active or they are treated with monoclonal antibodies and they have bad prognostic factors, we start with the treatment 2 weeks after the delivery. For some treatments like ofatumumab or Copaxone or interferons, when the patients they want to have breastfeeding, we can give at the same time this treatment. So that for some patients, they can have at the same time breastfeeding and the treatment. So that with this protocol, that's to reduce the relapses, to reduce the clinical activity before the pregnancy, to do an MRI after 2 months after the delivery, and we decide to put some patients with the treatment 2 weeks after the delivery. We have reduced our relapses after the delivery in the postpartum phase, and we have only 7% relapses after the delivery. So that we have a very good numbers, and we try to implement this strategy in many other hospitals in Spain.